Hi everybody, this is Gabby Simons, registered dietitian with Nutrition for Addiction. My goal is to bring providers treating and supporting people with substance use disorder nutrition information that can be simple and actionable and help your clients and patients with harm reduction and in recovery. So today we're going to talk about part 2 of Nutrition for Mental Health. We talked about blood sugar crashes in the last video. This is going to be about the different food groups and balanced meals and snacks and how those actually contribute to mental health. People often think you only go to a dietitian or a nutritionist if you want to lose weight. Absolutely not. Nutrition supports our body and mind and spirit, and today we're talking about how it supports mental health, having nothing to do with body size or weight loss. So we're going to use this model called the Healthy Eating Plate by Harvard University as our model of the different food groups and a visual of how to create a balanced meal. So we say to aim for about at least three food groups in meals and 2 of these food groups in snacks. And it looks similar to the My Plate, which you may be familiar with. My Plate came after the food pyramid. So there's kind of continuous revisions to these models, which aren't perfect, but they are helpful. So I'm going to go over each food group in brief and tell you how they contribute to mental health, and then there'll be more detail in the notes below. So let's start with whole grains. Whole grains we could also call this food group healthy carbohydrates. Whole grains mostly contain carbohydrates as their macronutrient. Just a little aside, the macronutrients are carbohydrates, proteins, and fats. Whole grains mostly consist of carbohydrates, and we need carbohydrates to help us produce serotonin, which helps to regulate sleep and stabilize mood. It's also, carbohydrates are the brain's preferred energy source. Now, the type of carbohydrate matters because, as we talked about in the last video, simple carbohydrates and sugars can potentially lead to blood sugar crashes. So it says whole grains, which contain fiber, which are less likely to lead to blood sugar crashes. Proteins are made of little building blocks, or we can think of them as beads that make a string of a protein, called amino acids. And these amino acids are important building blocks of neurotransmitters in the brain, including serotonin and dopamine. And we know that our folks in early sobriety, after using, have really low levels of dopamine that might lead to cravings of sugar and caffeine and cigarettes and, of course, drugs and alcohol, because the body's wanting to increase that dopamine supply. So let's do it in a nutritious way, making sure to get protein in all of our meals. And this can be from plant or animal sources. So things like milk, chicken, fish, eggs, beans, nuts, and seeds are all great protein sources. The other things that protein-rich foods have are some of the B vitamins, which are associated with mental health. So vitamins B6 and B12 are found in these protein-rich foods. How do fruits and vegetables contribute to mental health? They contain some of those B vitamins. So B6 and folate, which contribute to mental health, and folate is often depleted in people with alcohol use disorder. Folate, think foliage, leafy green vegetables. B6 contributing to brain function. We talked about it being in proteins, but it's also in leafy green vegetables and certain fruits. Now you can see this little healthy oils jar. So that is our fat category. And certain fats can definitely contribute to mental health too, specifically omega-3 fats, which reduce inflammation in the body and in the brain, and can potentially improve symptoms of depression. And omega-3 fats are found in canola oil. They're also found in walnuts, flax seeds, and chia seeds, and the oils of flax and walnuts. And certain fish, fattier fish like salmon, sardines, herring, and halibut. So this says healthy oils, but we want to think of healthy fats aren't always oils. They can be in the form of those whole foods too. Water is important for mental health, mostly because of what dehydration does that detracts from mental health. So dehydration can cause irritability, trouble concentrating, and feeling of disorientation. And so drinking water can be a simple way to help people bring more stability into their mental health as a harm reduction measure or in recovery. And so people don't have to drink plain water. It could be water flavored with a little Crystal Light or little flavor drops, water with some lemon, seltzer water with some juice. All of those are valid. And then what's not shown here is caffeine or caffeinated beverages, but I do want to speak to that because a lot of people in recovery rely on caffeine to get that boost of energy, and that could be in the form of coffee, often sweetened with a lot of sugar, energy drinks. You can talk to your clients and patients about how caffeine can actually trigger anxiety and negatively impact sleep, which leads to a whole cycle of poorer stability and decreased mental health, because sleep is so important to our mental health. So we can encourage people who are interested in improving their mental health through food to slowly reduce caffeine consumption. So to maybe start with one of their coffees a day as a half caff, then 2 of them as a half caff, then 3 of them as a half caff, meaning half caffeinated, half decaf, and to try to stop drinking highly caffeinated beverages after 2 or 3 p.m. We can encourage people to move to black tea, which has less caffeine than coffee, if they're going to drink a energy drink, maybe to reduce the portion a little. So baby steps. So that's it for now. The takeaway message here is that eating from multiple food groups, at least 3 of these food groups at meals and 2 at snacks, not only helps with energy levels and blood sugar levels, but helps with mental health because of the different nutrients in the food groups. So again, I'm Gabby Simons, dietitian at Nutrition for Addiction. You can follow along here for more videos. Make sure to always see the show notes where you can get a handout to talk about these concepts with your clients and patients, and on Facebook and social media at Nutrition for Addiction. I'd love to read your questions and comments below. So if there's something else you want me to expand more on or questions you have, I will absolutely touch on that and get back to you. Thank you for following along, and thank you for the work that you do in supporting people dealing with substance use disorder. It is such important work.